I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and I'm practicing in Santa Fe, New Mexico. Recently, one of my patients asked me if they really need to have lymph nodes removed when they have a really small breast cancer like this one that you can see on this MRI. Their cancer was less than a centimeter big, and it was estrogen and progesterone receptor positive, and they had a lymph node ultrasound which showed that all of the lymph nodes looked totally normal. In the past, the standard of care has been to remove 1 or 2 lymph nodes, the first ones in the chain, to make sure that breast cancer, which is invasive, has not spread to the lymph nodes. This is the SOUND trial, which was a randomized clinical trial looking at if we really need to do that for women who are postmenopausal. This study enrolled about 700 women in each group, and they compared women who did have sentinel lymph nodes removed with women who did not. This is what the trial showed. The first graph demonstrates disease-free survival, and the golden line is patients who did not have sentinel lymph nodes removed, and the darker line on top is women who did. And you can see that these survival curves are very similar. And the second graph shows overall survival, and the line on top shows women who did have sentinel lymph nodes removed, and the line on the bottom shows women who didn't. And also these curves are very similar. The study concluded that for postmenopausal women with small cancers like this one, it is safe to omit sentinel lymph node biopsy or not remove any lymph nodes. The caveat, however, is that about 80% of both groups did undergo whole breast radiation, meaning that they had 3 to 5 weeks of radiation therapy. Nowadays, sometimes we give partial breast radiation where patients might get away with 5 or 10 radiation treatments. And we don't really know if, when we don't do as much radiation, if the results would be the same. But if you are someone who is postmenopausal and you've been diagnosed with an estrogen and progesterone receptor positive breast cancer that is small and slow growing, and your surgeon doesn't mention this trial to you, you should mention it to them. Ask them, have there been any recent studies talking about whether we really need to remove lymph nodes? And then y'all should come up with the right choice for you together.